So what's the way forward for medicinal cannabis in the United Kingdom? In order to be able to provide a sort of multidisciplinary approach and to bring about introducing this drug in a safe manner so that it can be a valid treatment option for our patients who have got mental health conditions, who have got long-term conditions, there are a few things that we need to do better and properly in the UK. In my view, the most important points to address in order to ease the way for this drug are: firstly, improved access, and that means being able to provide it on the NHS, but also have a very streamlined, well understood process of creating a prescription that can be using the same channels that right now other drugs are being prescribed. That's not happening right now. The second is to increase the funding for research. We need good, solid research that is going to provide the evidence for the right drug at the right dosage at the right time for the right patient. And that can be possible when good quality research is done, but we need ring-fenced funding for that to be made available. The third point is around addressing the stigma and also at the same time raising awareness and educating the healthcare providers who are going to be prescribing the drug, but parallelly also talking about it to the general public at large, reducing the overall stigma that has been in society for many decades. The fourth bit is the regulatory approaches. We need to ensure that the scheduling doesn't slip back, and we need to improve on the scheduling, maintain it so that the drug can be legally provided to clinicians to do the research and for good guidelines to emerge from the research evidence. The next point is about making it affordable. I think once we have the research and the guidelines in place and we can offer it on the NHS, it will become much more accessible. But it is also about having good contracts in place to make sure that the drug is affordable for a large part of the public who right now have to pay for it out of their own pockets. The next is around expanding the treatment options. As we get it more affordable, we have to then do the research that will inform on the right kind of treatment pathways for different conditions and probably for newer conditions that might benefit from medicinal cannabis. And finally, the last bit is around consistent supply chain and quality control. Right now, with it being a sort of Wild West market, we have a lot of manufacturers, a lot of growers, and there is inconsistency sometimes in terms of the cultivated varieties, in terms of quality control, in terms of availability of a particular strain or a product. And all of this can be better resolved when you have these kind of steady state factors in the government organization in terms of regulatory frameworks. But the way forward is to ensure that we have a steady supply chain and good quality control mechanisms in place. When all of these steps are put in place, I think the way forward will be there to provide this drug in a safe and effective manner to the patients who are going to benefit from it the most. Thank you for listening to this video, and I look forward to seeing you in the next one.